Now turning our eye to COVID-19, new infections fueled by the skyrocketing Omicron variant are now falling across the country. There are more than 570,000 cases reported Friday. That's down 24% this week. But hospitalizations remain at peak levels and deaths are rising.
Another day, another COVID positive written on body bags in a Kansas City morgue, as Omicron drives the daily death toll higher than last fall's Delta wave.
We have been trying to scream at the top of our lungs to say how bad it is.
Hospitalizations are down nearly 5% nationwide, but almost all Americans live in a high-risk area.
I think all over the country, there's this just incredible fatigue. We thought this would be over by now.
Healthcare workers are still on guard. Dr. Jeremy Faust of Boston's Brigham and Women's Hospital. Do you fear there will be more spikes and surges ahead?
I think predicting this virus is bad business. I think that no one had ever heard of Omicron on November 23rd, and then it took us all by storm.
And now another possible threat, a stealth new subvariant of Omicron. BA2 has popped up in nearly half the country. Do you see other variants that could be very deadly happening?
I do predict that we will have new variants. Whether or not they would cause worse or milder disease is a wild card.
Faust says vaccines are the best defense against COVID. Still, a quarter of Americans haven't gotten a single shot. There's also resistance north of the border against masks and other mandates. Today, thousands of truckers rolled through the capital city of Ottawa to protest vaccine mandates for drivers crossing the U.S.-Canada border.
I do long hauls all over the country, and I shouldn't need a mandate to go wherever it is I'm going.
This new Omicron stealth subvariant is called that way because it's harder to detect. Scientists expect it to be very contagious, but they're hard at work to figure out whether or not it could lead to another surge. Now, authorities in New York say 2 nurses on Long Island are accused of forging COVID-19 vaccine cards and pocketing more than $1.5 million from the scheme. They say the pair charged $220 for adults for fake vaccine cards and $85 for children. The suspects also entered the false information into the state's immunization database. The scheme, which had been going on for a mere 3 months, unraveled when an undercover detective received a forged faked card showing a vaccine was given but never administered.